This
The only
conference
one
will
we're
now
missing
be
right now is
recorded.
Deidre.
Okay, Janine's here. I'm gonna step out. If you need me,
Okay,
let me
great. Great.
know. I started the recording. Janine,
Okay, thank you.
we're not using that one. Okay.
Well, hi, everyone. I think we can go ahead and get started. And I've shared my screen. And so you should be able at this point, I believe, see the agenda. And so we'll approve minutes. And then I'll summarize the conversation I had with Scott Lloyd from the accounting firm. Talk a little bit about the Tabor College COVID testing plan and see how the task force feels about some funding there. I'll probably have mostly Randy talk about the mobile emergency command center idea and talk some funding ideas there as well. And then an update on the expense reimbursement request from county agencies and establishing starting to think about establishing priorities for our direct aid plan, which some of that language is a little bit new, at least for me it is, and I'll clarify. And then consider the emergency services resolution question that was posed last week, which I really did not get an answer to that. And so that'll be our agenda. I think everyone received both copies of both the sets of minutes, the one from a week ago Friday, and then the one from the special meeting that we had this week to hire our administrative assistant. And so I trust you've had a chance to look those over. I would accept a motion to approve the minutes.
I'll make that motion.
Randy moves. Is there a second?
I'll second it.
I grabbed Janine's second there. I know there was more than one, but I think I got Janine's down. Is there any questions or discussion about the minutes before we move to, or before we call the question? Hearing none. Is there anyone opposed? I'm gonna take that as all in favor, so the minutes are approved. A couple of miscellaneous things. One is Christine's absent today simply because she had a prior commitment and was going to be out of town from Thursday through Sunday. And so I knew this was going to get off to a little bit of a slow start, albeit her and I have connected a couple of times already. I'll be sharing my screen, like I said earlier, with different documents. The way I'll try to gauge on this virtual format speaking courtesies is when you have your microphone muted, and if everyone could do that now, that'll be helpful. I'll assume that means we're sort of in a listening mode, or that person is, and when you unmute, I'll note that, I'll notice that, and then I'll take that to mean that you'd like to speak at that point. And then finally, we do have a new organizational chart. So I want to share that. And so that's going to take me a minute here. And this will just be real quick. So thanks to Randy for doing this. And the only change is that, as you can see, we've added Christine Flaming as the administrative assistant for operations there. So otherwise, the organizational chart remains the same. So, yeah.
Rusty, out of respect to Deidre, I'm going to get rid of the purple, and I'll find a blue color for her because she's a KU person.
Okay, that sounds good.
Thanks, Randy.
Hi, by the way, Deidre. So I'll share the agenda again. Which next on the agenda is a summary of my conversation with Scott Lloyd. Had about a 45-minute conversation with him yesterday and another 10-minute conversation with him this morning. He was able to helped me at least connect some dots that I'd like to share with you all. Still in a learning mode for sure. I have a conversation with the chair of the Harvey County task force at 2:30 this afternoon, and I know who that is. Scott told me, and then it turned out that I know him from a previous job that I had. Scott told me that he's really sharp. He's really been able to get up to speed on a lot of things. So I may gain some additional insight there, which I will share with you all. But here's what, and for many of you, this maybe isn't as new as it is for me. And I can't say it's totally new, but it's starting to crystallize a little bit for me. We're in phase one of a several phase approach that the state of Kansas has given for us. And in phase one, there's really two parts to it. I was thinking of them as merged, and the truth is they've got to be very separate according to Scott. One part is what he kept referring to as the reimbursement, and the other part is the direct aid plan. On the reimbursement part, Scott's understanding is that is for schools, public schools, cities, city governments, and the county government. That is for expenses they have already incurred between March 15 and July 31. And he strongly emphasized that we should not only have them send those in, obviously, on the spreadsheet that we've provided, but also they should provide receipts for all their purchases. Otherwise, if the state audits it, finds a problem, the county's going to be out the money because the state's going to require that the money be sent back, so to speak. So the one piece of that I'm not certain on is whether it is in fact the reimbursement phase limited to schools, cities, and the county government. But for now, that's, I think, what we have our eye on. The accounting firm sees their responsibility to give consultation, to compile the results into one sort of spreadsheet. So each of the schools, the cities, and the county are turning in these reimbursement request spreadsheets, and then they'll compile that into one document. And then they'll assess the validity, legitimacy of what's been requested. And they'll filter out things that perhaps don't fit the definition of what is a legitimate reimbursement and what's not. Once they assess it and the task force and the county commission approves it, then they will file it with the state. The state has said they have until September 15 to make a determination. And Scott says that while some counties are choosing to distribute funds ahead of that determination by the state of Kansas, he does not advise it, again, because what if they determine that something was not a legitimate reimbursement expense? Then the county's out the money. So I feel that we as a task force probably need to decide, are we going to press our commissioners to distribute any money ahead of that date and just trust that it'll meet the requirements? Or are we going to follow the advice of the accounting firm and wait till September 15, possibly earlier, to release funding until they've given official approval? So I'd like to hear some of your thoughts on that piece.
Rusty, I fully understand the accountant's stance on this. I went back and I read through some stuff that I think Janine had sent out to us, and some things that I know would really help my group would be if I don't know if it's this group or if it's the county commission, come up with a number that they're willing to transfer to the schools. And it says there on that sheet that she sent out, I think there's a deal on there that they can transfer those funds to the school districts of the county. It's much easier for us to budget that way if we know around what that's going to be. To give you an idea, right now I have from the special ed co-op in 3 districts, still waiting on stuff from 2 other districts. I have requests that are pushing $1 million. And in order for, if we're waiting till September, you know, we're wanting to start school quicker than that. And a lot of these items are things that are necessary for us to begin school with kids and staff in our building. And I guess I would ask the committee, you know, do we have a recommendation for the commissioners with this 2.3 million? How are we going to divide that out? Because, you know, yeah, we can order masks and our gel and everything like that, but there's some other things on here, you know, some air purifiers, some stuff like that that's a much larger expense that if we order them without the approval of the Spark committee and the Sparks monies, then some of us, I mean, we could end up behind the 8 ball in a little bit of trouble, if that makes sense.
It goes and it goes. It's one of those.
Yeah,
It's
so
freaking hot out. It's almost like it's melting the antennas or something. Okay, sorry.
could everybody mute their microphone when not speaking? That'd be great. Thank you. So Aaron, that I hear where you're coming from. I'm trying to assess what, you know, what Scott told me. And so I asked him, have other counties already released monies to schools? And he said yes. And then he said, I don't recommend it. And then he told me why, you know. So he also told me that the reimbursement requests for counties of our size, for schools, cities, and county governments, are running between 250 and 500,000 of what will be approved. And beyond that, he said that's where you've got to put programs in for your direct aid plan, which could include things for schools, could include things for nursing homes, other nonprofits. That's how he worded it. Releasing funds ahead, I know is permissible. We have the money. We can do that for sure. And so I hear you saying you just think there's a need for that.
Well, I think there's a need, but there's also the need for us. I mean, we all live in the world of budgets.
Right.
We need to know what that budget is. You know, a couple of things I'm looking at are 5 weeks out. Well, if I don't have that decision till September 15th, that can hamstring, you know, all the safety protocols that we're trying to put in place. That's why, you know, I would ask the committee, you know, what is our thoughts of how are we planning on dividing this pie? And maybe we take that to the commissioners and they can say, okay, yeah, we agree or don't agree, just so that, and I'm speaking specifically for my group that I'm representing, it helps us budget wise to know kind of what we're looking at.
Yeah, it's kind of crazy because Scott told me that the state very specifically defined this part 1 of phase 1 as a reimbursement initiative. So the things that you've already purchased that fit under the guidelines of what can be reimbursed are supposed to be turned in. And then if they fit, according to Scott, as long as there's money there for them, they get reimbursed. And so what you're saying is, well, yeah, but we may not want to spend some money on some things if certain things won't be reimbursed. That's what I hear you saying.
That's exactly right. We're living within a budget, and if I know how much Sparks funds I'm going to be receiving, then I can prioritize on my list and not have to order everything at once to get reimbursed, if that makes sense.
Yeah,
Because
it does make
if
sense.
it's not approved, I'll run out of money.
It does make sense. And what he told me this morning is what we're supposed to do with that, the anticipated needed future expenses, and we're supposed to put a program in place as a part of part 2 of phase 1 that says, for example, our school districts will have some amount of money for these things that they can pull from. Each school district will get this much money, and they're used for air purifiers and X, Y, and Z other things. So I don't know, I don't know what to say for sure about this, because I'm using the information coming from our consultant right now. And so I don't know what to say for sure about it. And certainly we can continue to press into it, but July 31 is right around the corner. That's the problem, is that July 31 is next week already.
Right.
If you don't purchase it by July 31, it doesn't fit into the eligible for reimbursement.
Right. But then our direct aid plan, which is due on the 15th, even if we knew from that as far as what parts of the pie, how it's going to be
There
divided
you
out,
go.
then I can be rolling with it. You know what I'm saying?
Yeah, that's a really good call.
Rusty?
Yes.
So you understand that, so if the school's budget for a certain amount and the county through this group approves it, they'll be transferring the rest to the county. In case that doesn't get approved, then the county is on the hook for that. Is that how that works then?
Yes, for part 1 of phase 1, that is exactly how it works. For part 2, it's different, because part 2 is a future type of thing, and you can't really start spending from it until the state approves it. That's the direct aid plan. So really, we wouldn't be on the hook, because until the state approves that, we wouldn't be distributing any of that money.
So, okay, when you say part 1 here, I just make sure this is clear. Part 1 is the reimbursed. That's pretty much a done deal, but the direct aid is the one that has to be approved by the state.
Yes,
Right.
that's right. But here's the thing, Scott's recommending that we don't distribute the part 1 reimbursement aid until the September 15th date where the state officially approves it. But I know some districts some counties are not waiting. They're giving reimbursement money to the schools as we speak. Some counties are doing that.
And there's a possibility part of that, the reimbursement.
Yes, that's true, but I feel like if the accounting firm looks at our reimbursement request and says, hey, from our assessment, we're good to go with that, then I would think there wouldn't be much risk at that point.
Yeah. Okay. That seems pretty clear. All right. Thanks.
Yeah, so that's actually kind of where I stand, is on the reimbursement part of phase 1. Let's get that together, get it in the hands of the accounting firm, get their assessment of it, and they can shape it in terms of what they understand about the legalities. And then once they've said, we believe this is good to go, then I think we could transfer the money. I don't think we're taking much risk at that point. And of course, the commissioners would have to approve that. But that's kind of where, as I've thought all morning about this, that's where I landed.
Okay.
Rusty,
Janine, go ahead.
didn't we already address this on our first meeting? That we were
Go
gonna
ahead.
hold. So if we change our mind, we need to change our. Can't find the minutes from the first meeting right now.
And just tell us when you found them there. I'm looking for them too.
Just real quick, I had a discussion with the economic development director from Rice County. She is in charge of their Spark program over there. She has said that they are allocating 25% of their funding to the school districts. They have 4 school districts there, and so how they're doing it is they're just assigning a number to a student. So, $250 per student is being dispersed to each of the schools there. I'm by no means saying that's what we've got to do, but I want to let you know that that's what it sounds like Rice County's doing. And they're in the same situation where their request from the schools far eclipses what they're probably going to be able to do.
And are they doing that as a part of their reimbursement or a part of their direct aid, Anthony? How did you understand that?
The way I understand, they are doing that as part of that direct aid. And I would say, as far as I know, they are not distributing that money yet. I don't know when they plan to. I didn't ask that question. I probably should have. And I don't have a problem calling her and asking her a couple more questions like that. But when we talked on Tuesday, she just wanted to kind of know what we were doing, and I told her I frankly wasn't sure how we were going to handle that yet.
So thank you, Anthony. That's really helpful. I'll come back to that. Janine, did you find the place in the minutes that you were looking for?
Yes, and it was just a consensus. It was not a formal motion, so I think we're okay.
Okay, thank you.
Read it if you want, but.
Yeah, thank you. Go ahead, Randy.
Just a point here. In my emergency management homeland security meeting conference call, we discussed a lot of different things. Funding was one of them, and funding for education was definitely one of them. In the current bill that's in front of the Senate right now, which has already passed the House, there is a bill in there for an additional $105 billion for education alone. I think it would be wise to wait until it's supposed to be voted on by next Tuesday. I think it'd be wise for us to see what next Tuesday brings before we start handing out funding for different organizations. I definitely want to support the school. The kids are important. But this may give them the extra money they're looking for, which would take care of, like Anthony mentioned, in the other counties where they had a shortfall. So this might help take care of that with the two together to finish out the projects they're looking for.
Thank you, Randy. That's helpful. Appreciate that information on the table. If I try to compile what I'm hearing and what I've also heard from Scott Lloyd, it seems like where we might be at is A, the reimbursement for schools, cities, and counties would be coming with receipts, and that money we might consider releasing per the accounting firm's assessment that it's valid legally well ahead of the September 15 kind of state deadline for their final approval, so to speak. We might be taking a little bit of chance, but in my view, not that much if the accountants have said, this looks good to us. I know other counties are doing that with their schools. And probably with their cities and counties too, would be my guess. I haven't checked with any city municipalities and counties, but I'm guessing they're doing it across the board for the reimbursement part of phase 1. With the direct aid plan, that's part 2 of phase 1. One of the things that almost certainly would be a part of that direct aid plan is some targeted money for our schools. Would it be 25%? Sounds like, Anthony, you're saying one of the counties is using 25% of the total allocation to the schools, and then they'll divide that up based on the head count in the school. That would make some sense to me. And that would let somebody like Aaron say, well, okay, then I know what my cap is. And so then I can begin to kind of work within my budget anticipating what I might be getting out of Spark. And then another thing I hear here from Randy is there may be another bill coming totally aside from the Spark funding that's earmarked just for public education, which then if Aaron says, well, I'm getting so and so much from the direct aid plan here, and it sounds like based on how that flows from the legislature, state legislature, I'll have potential for this much more. It continues to help him to think about how to work within his school budget for continuing to make decisions. Is that a decent summary of where we're at, or does somebody say, no, Rusty, actually we need to tweak something you said there?
You know, I would also point out that, you know, although we may not be able to release the direct aid money come August 15th, we will know where we're putting the money, where we intend to have that money. Because we have to have that August 15th, we have to know that so much is going to the school, so much is going to wherever else. So, you know, Aaron, you will have an idea come August 15th where the money's going to go. It's just a question of whether or not you'll have it in your hands at that point.
That's exactly right. So I'm going to use, but before I do, other clarifications or any other tweaks to the way I summarize this? And not that we didn't vote on that, so I'm not saying it's set in stone, but does that feel like a direction we can continue to head down this path with some of those, signposts?
One of the things the state kept calling the direct aid was a budget. So if that helps clarify in your mind that it's how we plan, but it isn't, you know, you might have to change things and it's permissible. So
Gotcha. So one of the things,
my mind.
yeah, I appreciate that, Janine. And that reminded me of something. And this, you know, I feel like this was a mistake, and mostly I just have to own it. But this is what happens when you feel really rushed. You know, the communication we sent out to all the public entities really had a mistake in it. And it essentially said to them, turn in both your reimbursement requests and your anticipated expenses all in one fell swoop. That was a mistake. Those should have been turned in two separate, kind of spreadsheets, which I now have, you know, yeah, I just didn't understand it clearly enough to word that the right way. So that's going to force us probably to have to do some, Christine's going to have to do some work. The accounting firm's going to have to do some work separating those out, because it is the anticipated future expenses that we build our direct aid programs around. And it is the reimbursements that just come in for nothing but monies that have already been spent. And so keep that in mind as you're having back and forths with the entities that are communicating with you. Does that make sense, everything I just said there, or is there some clarification that needs to happen?
I think that makes sense. I'll make sure that anything that's been spent will get turned in on that spreadsheet. And we'll get that turned in by the 31st of this month. And then by the 15th of next month, we'll know what the direct aid plan, what our portion of the pie as far as being able to plan that way. You know, and I don't want to go in depth too far, but one thing that is kind of hamstringing schools is, you know, our fiscal year is July 1st to June 30th. And so, you know, we're kind of tied to what funds we have coming in. So I think that's part of the need of us to know what portion of that pie, because we're starting to formulate those plans as far as, you know, we're all looking forward to getting school started, and we're all trying to figure out what all things we need in place to ensure that all staff and students are safe. So that makes a lot more sense to me anyway, and I'll try to convey that to my group.
Yeah, Aaron, I just did a very, very rough assignment of numbers. So that in no way could you depend on this, but it just gives you, I think it'll give you an idea. If we did 25% of the total funds in our direct aid plan for schools, and if my numbers in my head are even close to right, you would have approximately $300 per head count in the direct aid that you could spend. That's real rough. That at least gives you something to kind of think about for now. And I only use the 25% because Anthony said that's some Spark task force had told him that's what they were doing. On your screen now is the subrecipient report for reimbursement, which we've seen that, and that's the one we sent to the entities. That along with their receipts is what they should send back for the reimbursement piece. And the ones that'll be made whole, according to Scott, on that piece are the schools, the cities, and the counties. And then I'm going to show you just a glimpse of another document. Somehow my screen locked up. Does everyone still hear me?
We're hearing you.
Yes.
Okay. Huh. Not sure why my screen locked up, but it did. But you can still hear me, so I guess I'm just going to have to wait and see what happens here.
You changed the script. Well, it's changed. There you go.
All right, it's still locked up. It won't let me. Is there anything on your screen right now that I've shared? I mean,
The agenda's there now.
the agenda's there. Okay. Huh. Well, anyway, I was going to show you just a glimpse of the direct aid plan, which we'll be talking about some at the end of this. I wanted to talk to you about what Tabor's done, and like you, Aaron, we've done this, and we don't have the money. We literally borrowed the money and did it. I realize that we have the luxury as a private institution to borrow money, and you don't. I get that, but we felt like it was really important for Tabor College, and we believe it could end up being really important for the county. And I'm repeating some of what I've already said, but we took our old Welcome Center building, we've turned it into a CLIA-approved lab. We've got a waiver for that. Hillsborough Hospital is going to oversee that with their lab tech and a nurse. We're going to test every student, every faculty member, and every staff member prior to school starting for COVID-19. Today, the analyzer and the test kits arrive. We anticipated some of this a couple months ago, and so we got in on a deal on these rapid antigen testing programs that now have run completely dry. Our hospital can't purchase them now. The family physicians that we have so many Tabor alumni and West Wichita family physicians, they can't get them. I don't know if the Newton Hospital or the larger Wichita hospitals have them or not, but we're going to have them in our county, and we'll also make that available to the extent that the county health department, Deidre, or the hospitals need to use it. We've got these, we turn around 30 to 50 of these test kits per hour with this. I talked to somebody yesterday who said, hey, I called the hospital. I need to get a test because I want to have it before Monday. I've got a little bit of a runny nose, and I just want to be sure before I jump on an airplane. And they told me here at Hillsborough, it takes 11 days to get a test back right now. So I just see this as a huge benefit to our county, and for sure for Tabor College. And by knowing which of our students that are coming, by the way, from 33 states and 13 countries, by knowing which of them have COVID-19 before they ever move into the broader community, and then put them in isolation because we're in the process of retrofitting the old Hillsborough Hospital for isolation rooms. It just provides a measure of security in the county that I think is a pretty important thing. So say all that to say that would be one of the primary things that Tabor's hoping will be a part of the direct aid plan, or if somehow we could see if the county wants to make it a part of their reimbursement request. So Randy or Deidre, I would especially like to hear from the two of you on that, thoughts that you have, ideas that you have about that.
Well, a couple of things on the old hospital. I know there's an expense to that and what's being done there. I will reach out to the state because there's currently, I believe there's 10 facilities the state's already set up across the state to house people who are quarantined. And I'll see if there's some state funding that can help maintain the one that you're trying to put together. See if it's out there. There's one, the closest one to is right now is Emporia. But I'll see if they have funds that can help out with your project on that.
That'd be great. And just what I might say to you, Randy, just to keep in mind is two things. One is Mennonite Disaster Service has agreed to do a ton of the work as volunteers. What a great organization MDS is. But they're coming in Monday to start that work. And then, but as you can imagine, there's still some expense. We estimate the expense to be about $20,000.
Okay, I'll get with you offline and we'll talk about those things, the expenses and stuff. And then I'll reach out to the state and see if there's a way through the FEMA money that we can help offset some of that cost.
Okay, because right now I built a proposal, but after I talked to Scott, I decided I wasn't going to present that to the task force yet. But I did put that expense into this proposal, and that the total of that proposal is in the neighborhood of $90,000. The test kits alone cost $60,000. Deidre, any thoughts on this? Deidre, if you're speaking, I don't think we're hearing you.
Okay, I have to take a phone call from the state, so I'll have to get back with you. Sorry.
Okay, that's fine. Okay, any other reaction to what I've shared? Maybe I'll just ask a question then. What I'm really wondering is, from your perspective, do you see this as something that's valuable countywide or not? Really, is what I'm wondering. I don't want to, I guess, run down a path that already is a dead end.
Well, I think Rusty, it'd be very helpful once Aaron and the other superintendents find out what the high school sports association wants to do, and so that's still up in the air. But they may run into some issues where they need fast results. That may be very helpful to them. And also with the group that I'm working with, the emergency responders, we'd like to see their stuff turned around quickly if they get exposed, so that we continue to provide the services that we're here. So I think it's a great idea. It'll be a great resource for the county. And if I remember correctly, in this particular system, you can set up for different kind of tests. So if we, for example, if we have a flu outbreak or if we have some kind of other issues, it can do quick testing for that too. Is that correct?
That is correct. And those test kits are much less expensive.
Right.
And much more readily available, those flu kits.
So it's a multi-use tool that we have that you're looking at, and I think it's a great idea. Kudos to whoever thought it up. I mean, they were definitely thinking forward on that. But it will be a great benefit to the county as a whole.
The Mark Rooker has tried to get a version of these Sophia analyzers and test kits in the hospital, and he's got a minimum of a 90-day wait. And ours are being delivered today.
Right. It's the hospitals have had some real challenges. They asked those very same questions at the onset of this pandemic, and they're still are getting blocked. So it's a good idea. Thank you.
Yeah.
I think from our perspective, this is really great. We could, easily end up having some type of outbreak in a local business, that this could be of a lot of help to us.
Well, the contact tracing and the ability to isolate source and prevent spread when you can know same day what the result of the test is a pretty big deal. It seems that way to me. Okay. Thank you for your input on that. I'm going to keep moving forward in my planning for presenting that as part of the direct aid plan, or if Deidre or Randy or others come up with other ideas about how to help fund it, we'll keep everybody in the loop on that. So now I'm going to turn to you, if that's okay, Randy, to talk a little bit more about the County Mobile Emergency Command Center.
Okay. I don't know if you can share the screen or not, but everyone should have received an email from me. It should have been a PDF file that was sent to you in reference to the trailer that we talked about last week. I visited with them. The trailer is there. The total cost of the trailer with all of the documents involved, excuse me, all the pieces to it, the components, is $75,000. That includes the radio systems that we put into it, the monitors. Of course, you got to have the chairs and everything else that go along with it. We'll also buy, I can't remember the title of what it's called, but it's a stabilizer cable or connection to make sure that the trailer doesn't wobble when it goes down the highway. So we'll make sure we have one of those to keep the trailer safe. This is the product. It'll be available for us. The company is holding it for us if we want it. It'll be 4 weeks before we can have it delivered. But that's, I've had the sheriff's department look through this, the sheriff has, Deidre's looked at this also, and I've had a couple other emergency responders, and they think this will be a very valuable tool because, as you can see, if you have the pictures in front of you, the seats and also the panel there for the table for the workstations, all of those can be mounted up against the wall. So if you have to use it for storage to haul something, then that's available too. You can use it for that as well. So there's those options there. Any questions? I believe we talked quite a bit about this last week. This is being built in Missouri, and they said we can have it in 4 weeks.
So thank you, Randy. After I talked with Scott, what he seemed to be saying to me is that either we're going to need to put this as one of the programs in our direct aid plan if we want to, or like I said earlier, this would potentially be a county initiative for reimbursement, but you would then, I don't know if this would fit under what the accounting firm would, if you bought this before July 31st. Yeah, I don't know how to think about that. It seems like it's likely, probably for consideration as one of the programs under our direct aid plan, but others, whether it's you or others, Randy, may see that differently, and feel free to share.
The challenge is we have until Monday to let them know. If not, it'll go back on the market to be sold. No pressure. I'm just telling you that's how businesses work, and we've all dealt with businesses. I believe it's a valuable tool that'll help us out. It can help the schools out as well. If we have to do a mass testing in one of their facilities, or even a long-term care facility, if we had to go to one of those where they have a lot of residents there, we can pull up and take care of what needs to be accomplished there. One of the items on there is a medical refrigerator that's specifically designed to keep all the everything Deidre needs to do her job at the right temperatures and everything else, so that she stays in compliance as well.
Right. Is this something that the task force wants to explore, trying to release funding for essentially immediately, or not? I would love to hear some feedback on that. I'm not, no thoughts?
Randy, is that something you could get turned in by the 31st?
You mean all the bills? Is that what you're talking about, Janine? Get all the bills and receipts by the 31st?
Well, I was wondering if it was something that you could run through this month's billing, so it'd be paid on the 31st and we could include it in our
Sure, I mean, yeah, I'm sure there's no doubt that I can get bills for everything that can be turned in by the 31st.
That's just an idea.
I think it's a good idea. I'm just wondering about the logistics of that. Does the county just purchase that and then it's on their reimbursed listing for, what we turn in on the August 15th, like with everything else they've done since March 15th? Is that your understanding, Rusty?
My understanding is in order to accomplish what Randy says would need to be done in order to actually purchase the one that we all got an email picture of and that he just described, it would have to be a part of the county's reimbursement request, which means they would have to expend before July 31, and B, then it would have to, we would have to believe that it does meet the qualifications for something that's a reimbursable expense.
Yeah.
Or we'd have to wait till September 15 to see the state make that decision. And if they decided yes, that does meet those requirements, the county would be made whole. If they decided no, or if they decide no, either way, even if we release the funding earlier, then the county would be subject to eating that cost.
Yeah. But there's not a mechanism for us purchasing it right now. It's either under a reimbursed or a direct aid later, correct?
That's correct. That'd be the two things. But if we release the money right now, so I'm going to assume something. I'm going to assume that the county doesn't have the funding right now to buy that. And I might be wrong on that, but if I'm right, we would need to release the money. The county commissioners would have to release the money. And then if later the state says, oh, by the way, that doesn't work, now the county's on the hook for the price of that.
Right. Okay.
Rusty,
Yes, Janine.
right now the county is paying all COVID-related bills through our risk management fund. And we plan to reimburse that with Sparks funds if everything is approved. So that's how the county is working it.
Gotcha. And would they have the funding if the task force recommended it and then the commissioners approved it? Would this relief fund you're talking about have enough money to cover this?
It should, yes.
Dave's asking, would you, if we needed to or wanted to, would we be able to resell this later?
Well, I guess you could always resell it. It's just, it'll be used for a variety of things, not just COVID issues. And I hope every day when I wake up, we don't have a disaster that day, but they could be used for those as well.
What I hear you saying is, and you've shared this with me before, Randy, and maybe the whole group, I can't remember, but is that if we purchase this for the immediate needs, then the county would have it for any needs that arise in the future that right now we can't anticipate.
Sure, I mean, it's a useful tool. I mean, and we continue to use it after COVID, whenever it goes away. We can use it continually for that. We can assist Deidre when she does flu clinics. She goes around to the different communities and does flu clinics or things like that. So I mean, there's a lot of uses for the vehicle, not just a COVID response.
Sure. I don't, yeah, I'm trying to think of how to process this, Randy.
But, from my perspective, I guess, it's releasing the money now to be purchased puts the county at risk, if it ends up not being reimbursed. So I guess my question really is maybe to the commissioners, if that's a risk that they're willing to take. I think from our part, I don't think any of us have a problem with Spark money being used for it. The question is whether or not the state will allow it.
Yeah, exactly. So, Janine, is the right approach here to ask Tina or whomever is the responsible person to put this on the agenda for Monday at the county commissioners and ask them, what would they prefer here? And maybe Randy could make himself available to give them an explanation like he's given us.
I would think that would be the proper process, so the county is aware.
Randy, would you be available if the commissioners wanted to hear from you Monday?
Later in the morning, I can, yeah, definitely.
What times their meetings run till, Janine?
Starts at 9, and since it's a budget one, I'm not sure how long it'll run. Probably into the afternoon.
Are you the one to try to get it on the agenda, or would that be Tina or who, Janine?
That'd be Tina. You want me to grab her?
Either that or talk to her after the meeting and see if she can do that.
Yeah, I'll talk to her.
Okay.
I can be available at 9:30, Janine.
Okay, great. All right. Thank you, Randy. Appreciate it. So I think we've already covered that next item on the agenda, update on expense reimbursement requests from county agencies. So let's start talking about establishing a priority approach for a direct aid plan. In other words, part 2 of phase 1, which is also due, by the way, on that August 15th date. So I would think next week we'll spend a fair amount of the meeting on this, but I thought we could brainstorm for a while right now on it. Even during this discussion or during this meeting, I feel like we've had several ideas surface. One would just be a percent allocation to school districts. That makes a lot of sense to me, actually. And then let them have some flexibility for whatever percent allocation they get and how to use it. And we would just trust them to, fit it within whatever the guidelines are that they'll be working with. Another idea that has potentially surfaced is a command center. Today, another idea that's surfaced based on what Tabor College is doing is a COVID testing lab. So these are potential programs for our direct aid plan that have already surfaced. What other things in you all's mind do you see potentially surfacing? Like, I'll give you another one that Scott mentioned to me that some counties are doing. They're taking a portion of the funds and they're allocating them for private business to make application to receive, grants. Like I think he said one county was allocating $150,000 or something like that, and businesses could apply for up to $5,000 grants or $10,000 grants. And as long as they met the guidelines that the county had set up, those grants were being pretty much approved in every case. They felt like they had allocated enough money at the $5,000 level that they could approve everyone who applied. So that is one idea, that we could allocate a certain amount in our direct aid plan for business grants, private business grants. And that would be in keeping with the part of the whole initiative that's revitalizing Kansas economically. I'll stop talking and see what some others are thinking along these lines. I think we have to start formulating ourselves here a bit. And I'm actually going to, my goal is in this coming week to take whatever we brainstorm a bit around here and go ahead and start filling out that form and just populating it with possibilities so that we get started on this. And I actually probably have Christine do that, but yeah, you get the idea. So what are you all thinking here?
The sheriff approached me on a project, and it'd be a joint use project between him and I. As we get into this, we'll be purchasing a lot of things, and one will be PPE and issues like that. And we talked about putting up a small storage facility behind the sheriff's building, 24 foot by 30 foot, with shelves and everything else in. So we got a place to stack everything because we'll probably be ordering a lot of stuff that'll be sitting, and not everything's going to go out right away. And so at least we'll have a place to put that. And then the cost of the shelving and everything else. And he also needs 2 laptop computers, and that's a $24,000 project.
Okay.
And I could forward you the sheet on that as well. I'll forward it to the team so they have it.
The county
Thank you.
will have additional wages for a lot of people too, and the ambulances considering purchasing the ventilators and some of those things for emergency to carry on there. So there will be quite a few bills for the county. I'll try and get those pulled together for you.
And are you talking more the reimbursement part or the direct aid part, Janine?
The direct aid part.
So I'm going to categorize that right now as kind of a first responders program. Is that what I'm hearing you?
Well, there's also wages from other agencies too. So like we'll have wages for people that are out, like the deputy sheriff, we have 14 days of wages for him. And I'm not sure if that'll come in on this billing or next. So we'll need to remember that the county will have quite a bunch of additional bills.
But those wages, are they in the reimbursement or direct aid?
I'm not sure which way they'll fall,
Okay.
but there will be wages. We have had wages for all 3 months, so they will continue. So
Now, can those wages, it's my understanding that if those wages were already budgeted in for the year like normal, then that is not, shouldn't be considered. Is
it
that?
actually, yeah, that's right. It actually can't be considered. The reimbursement and direct aid plan has to be things that were outside the budget of the organization.
and that's what these are.
Wages
So
that were outside the budget.
So it was extra help, because I know that's where ours falls in. Ours falls into extra staff, but that will come for in the future.
And that's more of the direct aid plan. So you're talking about county and first responders, a variety of things, whether it be equipment or personnel costs. That's what you're talking about. But the whatever's been incurred up through July 31st would be a part of the reimbursement, and what's going to be planned for in the future will be a part of the direct aid. So keep that in mind, Janine.
Right.
Deidre, are you up to speed on how our conversation's centered right now?
No.
Okay, we're centering right now on the second part of phase 1, which is ideas for our direct aid plan, program ideas. And so a list that I've started that I've heard us talking about in no particular order: a percent allocation to school districts, a command center, a COVID testing lab, business grants for private businesses around the county, storage facility for PPE. That would be in conjunction with emergency management and the county sheriff, and then first responder equipment that might be needed to handle certain types of emergencies that arise out of the pandemic. And so what we're doing is right now, we're really in kind of a brainstorming conversation about what are some programs that we know are kind of surfacing that we might consider for our direct aid plan. That will be part 2 of this first phase.
I know that I have hired 2 PRN nurses, and so I'm looking at taking their salary out of that. Also, it seems like we're getting a lot of requests from other healthcare facilities about maybe getting some type of courier to take lab specimens up to KDHE. So that would be kind of a expense also that I would be looking at. The nursing homes and medical, other healthcare, I think I haven't got a lot of response, of specifics, but I think PPE is a big thing that might be coming in.
And that would be that in itself could be an initiative right across the board to make it available for the county as needed type of thing.
Correct. And that might be something if we decide to allocate X amount of dollars to the schools, maybe we would decide to allocate X amount of dollars to long-term care facilities or assisted living. I don't know. I'm just throwing that out.
Yeah. Good point. I'm getting some of this down because what I want to do is work with Christine this week and get her to start filling out just like a starting point for this direct aid plan form that we have, because as a task force, we're going to have to make decisions. There's going to be more direct aid program ideas than there is money to cover. And so we're going to have to make decisions on how to use the remaining funds after the reimbursements are covered.
I'm still open for a vacation.
Can you say working vacation?
No.
I can't take my laptop and work. Yes.
Okay.
Rusty,
Yes,
would
Janine.
have Christine share that information with me too, so I'm kind of caught up on it too.
Okay, and are you talking about that direct aid plan form that I'm going to ask her to start filling out?
Mm-hmm.
Okay, yep. I'm actually going to ask her to share that with everyone, but yes. Okay. I'm going to go around and give everybody one more chance if there's ideas in your head, but as the week goes, and you're paying attention and doing your own research, don't be afraid to jot down a few notes about programs that you think might fit. We had asked, and I'd sent an email, and Janine, maybe you know something here, but I still don't. And I feel like it might or it might not be a lingering question, whether the emergency services that may or may not fall underneath a city's kind of overarching authority need to pass their own resolution. So I had emailed out that question to Jonah. I have not got an answer on what the commissioners expect on that. So I don't know if anyone else has further information on that. I don't have an answer on that, is my point.
As far as emergency services, that's the group I take care of. The only ones that wouldn't fall under a city or county resolution that's being written would be those that are fire districts, rural fire districts. And I've told all my fire chiefs just to have their fire districts sign a resolution and go with that. That seemed to be the direction everyone was talking the other day. So there's no reason to change it. We'll just have them sign a resolution of their own. They are a fire district. They're an elected board.
Very good. I think then we've brought resolution to that question. Thank you, Randy. That brings us to the conclusion of our agenda for today. Our coming timelines, the one that's the most pressing is the August 15th, at which time all the reimbursement requests and all of the direct aid plan programs that we are going to recommend to the county commissioners have to be ready. We've asked for all that to come in by, I believe, what was it, August the 3rd? So that there would be time for Swindoll, Jansen, Hawk, and Lloyd to work with it a whole week. And then the commission would have it ready on, I think, the 17th or whatever that meeting date is to approve it. And then Swindoll, Jansen, Hawk, and Lloyd will then file it with the state. So that's what we're up against. My closing remark would be the various entities need to know that A, the reimbursement requests really are for schools. This is what he told me yesterday, Scott Lloyd, are for schools, cities, and counties. And they have to be expenses that have already been incurred and outside of their budget between March 15 and July 31. Those are due August 3. Next week, we're going to have to finalize our direct aid plan. And so we'll try to do some work via email during the week. And then we're going to have to just, dig in. So next week, we don't have a meeting on the calendar for Friday because I think there were people who couldn't make it. Am I remembering that right?
There was a CARES meeting at 10 o'clock on this coming Friday on the 31st.
Gotcha. And remind me, a CARES meeting, meaning a state meeting or a county level meeting or what?
A state level meeting.
And that's from 10 to what?
Probably 10 to 11. It's a Kansas Association of Counties CARES meeting.
Gotcha. Could we meet on Thursday? I mean, I can. Can others meet on Thursday?
I can.
I can in the afternoon. I could try to make the morning work.
Should work for me.
What about
Just a
I
note.
can't in the morning.
okay. What about 1 to 3? How does that work for folks?
That should work.
I might be a little late. I got a Zoom meeting at 12:30, but
Would you like us to go 1:30 to 3:30, Aaron? How does that settle with everybody?
Good.
that'd be fine.
Are you all, this is Tina. Are you all talking about an in-person meeting or just online?
Well, probably by the way our habits have become, I'm thinking probably mostly online. If it's going to be more than Janine and I'll come to the courthouse, no problem. Might be good for a few of us to come so that Christine can familiarize a little bit,
The issue I have, we've got an election coming up and I'm using this room for
Okay.
quite a few activities for some advanced boards that are coming in and our public test and some other things.
Okay.
Thursday and Friday, we have something going on in this room next week.
Okay.
So,
I see.
yeah,
Well,
so if you do it online, that's fine, but I just won't
Okay.
have this.
Well, I think that's a decision then. Thanks, Tina. Let's just plan that it'll be virtual that day. Everybody will be virtual. That'll be fine. That won't be a problem. Okay, so I'll get it scheduled for from 1:30 to 3:30. Okay? All right, very good. Thanks, everybody. Have a great day. Bye.
Thank you.